Hi, I'm Dr. Keller. Thank you for your interest in fillers, wrinkle fillers. And as you may or may not have seen on our other tape about Botox, I want you to be aware that there's 4 kinds of wrinkles. And the first kind of wrinkle are wrinkles of expression. Hi, how you doing? Oh, I'm so angry. And that's your personality. We do not want to change that. That's what makes you unique. Second kind of wrinkles are what we call collagen wrinkles. If this is the skin and there's collagen underneath it, when that collagen is nice and thick and young and pushing the skin up, the skin is smooth. Over time, that collagen can become degraded, and so the skin begins to fall and it forms what we call fine wrinkles. And that's the territory of intense pulse light or photorejuvenation. The third kind of wrinkle is Botox country, and that's these glabellar, the frontalis, and these lateral canthis. And that has to do with muscles, and I would refer you to my videotape on Botox for a little more discussion on that. The fourth kind of wrinkle are what we call static wrinkles, and that's where the skin has actually been torn and there's a furrow under the skin that we need to go underneath and push the skin up. Classic examples of those are these nasal labials, these which we call marionette lines. Sometimes people get corrugation here of their muscles, and that's the filler territory, and that's what we're going to talk about on this video. I use in my practice 2 types of fillers. I use something called Juvederm, and I use something called Radius. The difference is that Juvederm is a little easier to apply and it doesn't last as long, but it's a naturally occurring compound called hyaluronic acid. And what Juvederm basically does is it's like a sponge. It's very hydrophilic. It loves water. So it draws the water in and plumps up your skin. How long this lasts depends on your metabolism and how your body likes this. If it likes it, it'll stay. If it doesn't like it, it'll chew it up. But it's a very, very good filler, and I primarily use it for your lips. So if you want enhanced lips, we would probably use Juvederm. And by the way, while we're at it, I want you to realize that I'm an artist as well as a physician. So I consider any of our procedures to be artistic endeavors as well as medical procedures. And lips are particularly susceptible to being filled correctly. Now, because I realize that lips are for kissing and not sticking needles in, what we do is I give you a dental block so that your lips are nice and numb so this does not hurt to do this. Now, let's talk about Radius for a minute. Radius is another naturally occurring compound in your body called calcium hydroxyapatite. And this thing can last anywhere from 8 months to sometimes 2 years. And what it is, and I primarily use it here and in here for those deeper wrinkles. Now, it acts like a scaffolding. So I put it in and it looks a little bit like a smooth putty. It doesn't feel strong. In fact, I put it in myself right here, and if you feel it, it feels normal. But what we do is we just take a line and we fill it like this, and it acts as a scaffolding. And what it is it's a way that your own body can lay collagen down in there. So when I put it in, it causes a little bit of an inflammatory reaction, and your collagen producing cells called fibroblasts say, what is that? They go over there and they attach to it. So we then have your cells laying down collagen, which begins to puff it up. It also has a hydrophilic component to it, so it attracts water. So what happens is over the next couple of weeks, it gets bigger and bigger and bigger, and it lasts for quite a while. What I have found is that over time it will collapse, but when I go in there maybe a year later and put another layer in there, we've got that basement membrane all filled up, so it actually sandwiches, and the second one is a lot better and a lot more, you get a lot more for your money on the second one. So these are the 2 fillers that we use. I numb you up, first of all, with a topical, and then we put a little xylocaine in there so that the needle doesn't hurt you. And then I mold it. Now, something you should be aware of with Radius, it takes about a week or 2 for this to set up. So one of the things I tell my patients is that they need to check every day or so to make sure there's not a little lump in there. And if there is, it's really easy to just push on it and flatten it out. You don't want to leave that lump in there, because if you do, it'll stay. So that's about the only downside of this. What I do want you to do is review my video on adverse reactions for any of these procedures. But my choice is Radius for these lines and these lines, Juvederm for the lips. And by the way, other places that we're putting things in particular is up here. If you look at a picture of when you were young and then look at you now, you may find that this area called the premalar fat pad has sunken in. And when that happens, as we get older, this zygomatic arch, the bone in it, actually demineralizes and pushes in. So our face is sort of collapsing as we get older, and the fat pad that's there drops down and it ends up giving you this big wrinkle right here. So the cure for that is to put fat or filler back in here. And it plumps it up and it carves off about 5 to 7 years. Now, besides the filler, we're also doing autologous fat grafting. So in that case, what I do is I go in and get your own fat, and then we put it in these areas. And the advantage of that is that most of the time I have a lot of fat I can use, and there's no shortage of that. So I'm not limited by just one syringe filled. Now there is something very, very new that we've started doing, and that's called a stem cell facelift. So we take your fat, and we process that fat, and we take out stem cells. We then add the stem cells back to some more of your fat and inject it. And lo and behold, you get a wonderful new face. And I'd like you to review my video on stem cell facelifts. So that's how we fill wrinkles. We use either Radius, Juvederm, your own fat, or the newest procedure is a stem cell facelift. These things are immediate results. I hand you the mirror and you will see an immediate result. And I dare you not to say wow after you see it. And over time, the swelling, over the next day or so, the swelling will go away and you should look fabulous. So thank you for listening. This is Dr. Keller. I'll see you soon.